I was doing circumcisions usually at the request of the parents when they, after considering the situation on their own, getting what information and advice that they could get, they requested that I perform the procedure on their boys. This is an example of medicine borrowing from religion, understanding that the procedure, any procedure that was requested or in fact required by God must have not only spiritual benefits but health benefits as well.
You know, I say right off, there's no medical reason to perform a circumcision. It hasn't been proved to, to prevent, significant amounts of infection.
There is not a medical indication for circumcision.
It's considered a social custom that an operator is performing. It's not really for medical reasons because the parents are the issue. The doctors will say it's because the parents wanted it done. The parents, on the other hand, say, well, the doctor did it and we asked him. So there's this collusion that continues, and that's why we still do it, because the doctors too many of them are weenies. They just won't say, I'm not going to do it anymore, it's illegitimate, I refuse to participate in this procedure. There's nothing medical, but we don't have enough doctors saying that.
It's a dilemma, and I don't like doing them. And I sit there and I think, well, should I keep doing them, and it's this thing I struggle with because I don't really like doing it, and I don't think it's necessary.
Doing circumcisions, even if you give anesthesia, some of the babies, scream and, they struggle, and some of them do less of that, but it's just not a very pleasant experience. Babies are crying, and, the parents are, some of the parents chose to be in the room, some of them chose to be out of the room. If they were in the room, it was usually difficult for them to be there. Even if they were out of the room, sometimes I would come out there and the mother would be in tears. This wasn't always the case, but there were certainly enough of those that that you could see that the parents were parents had ambivalent feelings about it, and it was difficult for them to see their babies in pain.
Overall, procedure seemed odd in that the way I began putting it together, you were taking an infant male, and the first genital experience that the child was being given was one of pain, and I found that to be bothersome. And in my own way, I felt it was a little bit unusual to then take this male infant that you'd given genital pain to and put it to the maternal breast. And I felt that it just seemed that we were giving a message to infants that I didn't feel comfortable with.
Every circumcision that I have done, I know that the baby is feeling something. When I do a dorsal penile block, I know that the baby is feeling that. Sometimes the blocks work real well, and I use a Gomco, and when I tighten the Gomco, by that time, then the baby sort of calms down. But up until that time, it's traumatic, I think.